Assalamu alaikum. Good morning to everybody. Thank you for being here. Once again, I'd like to thank Ms. Aminat Gulfishan for inviting us here, for the hospitality, for the care. Just thank you so much. I think all of you should be very, very grateful to her that she arranged this, because after you finish with my talk, you will go out a different person. You will go out with hope. First, I just want to understand, all of you understand simple English? Everybody understands? Okay. So, I'm Dr. Alok Sharma, and we come over here as friends. We have a long history of togetherness, including Indian films. How many of you have heard of Shah Rukh Khan? So we have a common history, we have common lives, we have a lot of things in common. So again, I'd like to gratefully acknowledge the Attu City Council, Honorable Mayor Ali Nizar, Aminat Gulfishan for our council executive, who's instrument and the key person behind arranging this, Hussain Zarif, the councillor, and Aminat Rashid, again, Honorable Councillor. I'd like to always, when I talk, I always like to let you know that this lecture is for awareness and information purposes only. This is not a substitute for medical advice, right, for which you must consult your local doctors. So why are we here? We are here because you all have special needs children, and these are children we love, children we would give our life for, and yet these children have a neurological problem for which you have been told there is no solution, right? That's the reason we are here, right? And I'm here to tell you that that has changed now. I'm going to show you some very exciting medical developments that are happening in this field. So what is new? The first thing that is new is that today we have new imaging techniques that actually show us which parts of the brain are damaged in children with autism. You will be surprised that before this, nobody knew this. Nobody had done scans of the brain. These children have a brain problem, and yet nobody had looked into their brains. But now we have studied the brains of almost 4,000 children with autism, another 3,000 children with cerebral palsy, and in every single child, what blue you see here, we have seen this damage. And when we do this in normal children, no normal child has this. So for the first time in medical history, we have shown which parts of the brain are not working in children with autism, because once you know what the problem is, then you can find solutions. So we have seen that these are technical terms, but they are parts of the brain which are working less. But we've also noticed that there are parts of the brain which are working more. So the whole thing is shifting today from looking at, earlier we looked at what the children cannot do. And the shift today is, what can they do that is extraordinary and different? You all may know that the world's richest man, Elon Musk, have you heard of Elon Musk?
Yeah.
He has autism. He talks about his autism, right? And yet today this man has changed the way the world is through his use of electric car batteries. So that is because they all have exceptional brains like this. So it is time we stop looking at what the children can't do and look at what the children can do. So this is published in a scientific paper we have written, where for the first time in a scientific paper we showed which parts of the brain are not working in these kids. We've also shown certain biochemistry. We've shown that they have low vitamin D levels. They have low hormones called oxytocin. We have seen that something called homocysteine is elevated, and we've seen that the mothers have higher levels of B12. During pregnancy, very often we are given a lot of vitamins, and that may partially be the cause. Not lower, but higher vitamin levels could also be a possible cause for autism. So what is new about the treatment approach? The old thinking was, brain is damaged, nothing can be done. The new thinking is, it is possible to repair brain damage through cellular replacement and repair. So these are the new treatments we look at. We will look at cell stem cell therapy, we look at oxygen-based therapies, we look at comprehensive rehab, we look at how to cleanse the gut and micronutrient imbalance. So that old thinking, nothing can be done, is not true anymore. There are a lot of things that we can actually do. So this is a X-ray of a leg. You can see this fracture. Can you see this fracture? Now, I ask you, if your bone is fractured, will you do physiotherapy on a broken bone? No, right? You would like to fix it. You will put plates and screws and fix it. But for our special needs children, we are doing exactly this. Their brains are damaged and we are giving rehabilitation on damaged brains. We are expecting our children to do things that they cannot do. Right? So, what if we could repair this? Can you see there is no function here, but there is function. And now we give rehabilitation and education, we'll get much better results. Luckily, today we have technology to repair this. And I'm going to discuss that technology. So let's look at autism. Dolly has been very nice and descriptive about what is autism, what are the causes. So I won't go into that, except to highlight what she has already highlighted. That in the year 2004, 1 out of 166 children had autism, which was 1 in 150 in 2004 and 6. And now you can see how it has gone up. Like last year it was 1 in 59, this year it is 1 in 36. At this rate of increasing autism, next year it may be 1 in 25, then 1 in 15. And these are not our figures, these are figures from the US CDC, Center for Disease Control. If you go to the CDC website, you will see this graph there. The US CDC has the most accurate figures in the world. And they are showing that this is the increasing graph. Now, if it has increased so much over the last 20 years, you can only imagine what is going to happen ahead. Soon we'll have more children with autism than we can manage. So it's time we did something about it. We do not have inclusive education. We do not have enough rehabilitation centers. We do not have enough governmental support. Different parts of the world are doing things differently. For example, in Australia, they have government insurance, NDIS, where all the rehabilitation is paid for by the government. In other parts of the world, there is nothing. In the Middle East, Dubai, they have something called People of Determination card. You get a special card with which you get a whole lot of privileges. In other places, they give you special education, but nobody has everything together. And it is important that as a society, we start looking after, because soon, if this graph goes up, the next year it may be something like 1 in 25, and the year after that it will be 1 in 15. So I want to emphasize the importance of this and that we need to do something now. So 1% of the world's population has autism. Now, the important thing is neuro rehab. So this is something which can be made available right here. You don't have to leave Atul City to get comprehensive rehab. And I'm very, very hopeful that soon we will have a full-fledged, comprehensive rehab facility available here. Sabinath, maybe you can take the initiative, because the city needs it. Today, the city does not have affordable, accessible treatment. Treatment should not just be available, it should be accessible and affordable. Because if you have something and it costs, you have to pay more than your monthly income for rehab, obviously it's not viable. So, I'm very happy to be here to say that this is something which can be done locally itself. So, the brain is like a computer. A computer's got hardware and a computer's got software. A computer's got hardware, software, brain has the same. So, our treatment can repair the hardware, but you need rehab and teaching for the software. So among the rehab, I'll go through this very briefly. One of them is psychology or applied behavioral analysis, which happens to work on the behavior. And this is ABA happening. You can see there is nothing required, no equipment is required for ABA. You just need trained people, training which we are willing to offer. There is occupational therapy, which has several components, from activities of daily living, play therapy, social, cognitive, school-based, recreational, vocation. All of these also don't require much infrastructure. You can see there is no major infrastructure. Simple things are required for this. There is sensory integration therapies, which does require a room. Again, very simple. Just the flooring, everything else has to be special. Speech therapy again doesn't require much equipment, it's just therapy based. And physiotherapy again is very useful, mainly in CP but also in autism. Again, if you see here, I'm showing you pictures to show no major equipment is required. Very simple things, just you require trained therapist. And aquatic therapy is very important. We found that aquatic therapy is not swimming. Aquatic therapy is rehab in water. And this is very useful. We are happy to train people. We have a certification program because this requires expertise. How to give them, all it requires a swimming pool, and you can actually train people. Aquatic therapy is one of the most useful therapies for autism. Art-based therapies, again, very simple things are required for that. So a combination of all of these, and putting this together, you will not see any fancy equipment here. It's very simple equipment. All you need are trained people, and that is something we are willing to offer from our country, from our center. Like I already mentioned, a 15-day training program, so that right here in your city, you can get all of this easily. Right? Then, now we come to the main part of my talk, which is on cell therapy. So what exactly are stem cells? The word stem comes from the stem of a tree. And just like from the stem of a tree, you get branches, leaves, flowers and fruits. There are some cells from which all the other cells of the body can arise. And these are called stem cells. So basically what we are doing is we are taking good cells, healthy cells, to replace the damaged cells. So this is the damage. We give cells and the damage gets taken care of. So how does stem cell therapy works? The cells, they have the ability to multiply. So one cell can become millions of cells. They convert. So the same cell can become into a brain, heart, muscle, liver, whatever. They improve the blood supply and they release certain positive chemicals. So all these actions together result in repair, regeneration and replacement. So basically what we are doing with cell stem cell therapy is replacing damaged tissue. There are two kinds of stem cells, those which you take from the patient, put it back in the patient, and those which you take from a donor. We prefer this method because it is simple and it is safe. So the way this is done is, we put a needle into the pelvic bone, the bone above the hip bone. We take out the liquid in the bone, and this takes about 15 minutes. Next, we take this to the laboratory where this is filtered. And once the stem cells are ready, with a very thin needle, we inject it into the lower back, and from the lower back, it goes to the brain. We take a needle, we put in the bone and take out this liquid in the bone. So just a needle prick. What we have taken out, we take to the laboratory and separate. And once we have separated, with a very thin needle, we inject it into the lower back. So have you seen? Only 2 needle pricks. With one we take out and with one we put back. So there is no surgery, no cutting, no stitching, nothing at all. Okay, it's a very simple procedure, no operation, just 2 needle pricks. And what are we putting in the child? The child's own cells. We are taking from the child and putting it back in the child. So now worldwide there are a lot of results of this. I'll just share very quickly some of the results. So if you see, there are a total of 33 scientific studies with almost 461 patients, in which 80% of the patients have improved. The world's first paper was published from India. We published that paper. The second paper came from China, third from Italy, fourth and fifth from America. The sixth was again our paper, then from Vietnam, Iran and the USA. So this is the world's first publication, and in this paper published by us, we showed a 91% success rate. Then in this paper which was published from China, they showed a 88% success rate. In this paper published from the United States, they showed a 90% success rate. In this paper, again published another paper from the United States, there is a 90% success rate. In this paper from Mexico, there is a 95% success rate. In this paper from Vietnam, there is a 93% success rate. In this paper from Italy, there is a 78% success rate. And this is again from a meta-analysis. This is again from a combination of papers where what they did is they studied 461 patients of other studies and said that it is safe and it works. This is again another meta-analysis from China, 325 patients, and they said it is safe and effective. So what I showed you was that worldwide, several countries have done work on this field. Our own results, so this paper of ours was published in the American Journal of Stem Cells in 2020. This is our paper. And here you can see this is the percentage of improvement. So social interaction improved in 67% patients. Eye contact improved in 80% patients. Attention improved in 80% patients. Stereotypical behavior improved in 53. Aggression improved in 56. You can see. Then hyperactivity. You can see all the improvements. So these are the symptoms and these are the percentage of improvements. So as you can see, there is a significant improvement in all the children. But what we found was the improvement was age dependent. So in children between 0 to 5 years, we had a 98% success rate. Between 5 to 10 years, it dropped to 95%. And then from 10 onwards, it became about 90%. So the results are age dependent. The earlier you treat, the better results you get. The later you treat, the lesser results you get. And this is again objective proof of improvement. You can see here the brain damage before, and you can see afterwards the damage has improved. So not only does the child improve, but when we do the scan, we can actually see improvement in the scan as well. So we have a total of 60 papers in autism and several medical textbooks. This textbook on recent advances in autism, this has got a chapter, and we have written that chapter. Now let's see a few videos of patient improvements. So this is the first is a child from.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So this is a 10-year-old boy from America.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
And in fact, recently his father just told me that he traveled to Europe all alone with his friends. He went to 6-7 countries, traveling with people of his age, without parents. A child who could not speak, a child who could not go to school, is today traveling all over the world. So this is one more video of this child from India.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on the feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, his emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
Is today taking tuitions for deaf children. That is the amount of improvement that can happen in these kids. So very quickly we'll go through cerebral palsy. In cerebral palsy there is a different kind of brain damage, but the effect is seen in the body. In autism it is in the mind. In cerebral palsy either one half of the body or just the lower legs or the whole body is stiff, tight, does not move. And as you can see, the brain damage is far more severe. If you remember autism, it was on light blue, here it is black. But even here with stem cells, there's improvement. You can see the damage before and you can see after cell therapy, the damage has gone. Again, we've published this paper. It's not the world's first paper, but we published this in 2014 about the benefits of cell therapy in cerebral palsy. We've published 15 other papers. We also have chapters, this is a European textbook, where there's a chapter, stem cell therapy for cerebral palsy, and we have published this chapter. One of them is oxygen-based therapies, or this is a little expensive equipment, but it can be made available. Basically in this, what is done is oxygen is given under higher pressure. So we are now breathing oxygen at 1 pressure. Here the child lies down in the chamber with a parent. And what happens is when we breathe normal oxygen, only the red blood cell, our blood has got red cells, white cells and a liquid. So only the red cells carry oxygen. But when you give it under pressure, the oxygen goes into the entire liquid. So the whole body gets lots of oxygen. Then ozone therapy. This can be easily made available in India because in Atul, because this doesn't require very expensive equipment. So basically oxygen is O2 and ozone is O3. It is a more potent form of ozone. It's like an activated ozone. And it kills all the infections, it reduces inflammation and swelling and has an antioxidant effect. There are very simple ways to do it. There's a chamber in which you can sit and you get it. You can give it through the ear, you can breathe it. So this can be made available locally as well. So this is how it works, improves the gut health, oxygenation. Then micronutrient supplementation. We found a lot of these vitamins and nutrients are deficient in kids with autism, in particular vitamin D. We found low. We find problems with the B complex vitamin. We find magnesium, zinc, etc. So supplementing these, and all this can be done here, helps improve their condition. Gut cleansing is very important. They have shown that there is a direct correlation between the gut and the brain of children with autism. And we, by cleaning the gut, again using ozone, we first do what is called a testing of the gut. We identify the infection and deficiencies, give specific treatment using pre and probiotics, and then we use rectal ozone. So cleaning the gut, we have found, helps in improving their behavior. So their hyperactivity, their aggression, all of that goes away. So the gut has a very important role, and again, gut cleansing can be done in Atu itself. It's not very difficult. There is advice on diet to have, there are foods to eat and foods not to eat. So ketogenic diet, gluten, casein-free. Camel milk is supposed to be very, very useful. So a lot of places in Africa found benefits of camel milk. Foods to avoid are sugar, additives, pesticides, etc. So this is a ketogenic diet that is useful, high fat, enough protein and low carbohydrates. So what is the scientific basis? We have a total of 106 scientific papers, 16 in autism, 15 in cerebral palsy, etc. All our work is published in medical books, as you can see. And we ourselves have published 18 books. We've just given a set of books for the council today. These are our books. And all these books are free. You can go to our website and download copies free of cost. Even hard copies we publish free. So above our books we wrote for doctors. But these are books we have written for parents. This is a parent guide for autism, parent guide for CP, parent guide for muscular dystrophy. Over here we give you guidance as to what to do at home. What exercises, what therapies, what diet. So these are parent guides, again, all free of cost. So we've treated over 14,500 patients from over 103 countries. So my conclusions are, newer imaging technologies gives us greater information. I don't know if a PET scan is available in the Maldives. Is there a PET scan in Mali? I don't know. But if it is there, we can get insights of the brain. For the first time, we can actually see what is the problem in the brains of the children. Multidisciplinary rehab, this can be made available here itself. With a little training and support from us, I'm sure you will take the initiative and we will make this available. Certain medical treatments can also be made available here. So at least we should start with something. We start with rehab, we start with medical treatments. Ozone therapy can easily be given here. We have a tie-up with the Ozone Forum of India. There's a foundation which does training and they'd be happy to even train local people here how to do it. It doesn't require much expertise. But right now, cell therapy is safe, it's an effective treatment. I showed you the science. This cannot be made available right now in the Maldives. For this, you have to come to India. So combination of imaging technology, rehab, medical treatments and cell therapy. This can get our children out of the spectrum. This can give them an opportunity to live an independent life. This can help them to get into the normal education system and become independent. So this is what, again, new brain imaging, comprehensive. It's comprehensive rehab, all rehab together. Cell therapy and integrative therapies. So I just like to end. Okay, so one of the other things that we have seen is the best results you get when there has to be an acceptance of the child the way the child is. Very often we don't accept our children the way they are. We have to realize they are not less than, they are different from others. We have to understand what is happening to the child. The whole family has to work as a team. We found a very important role of family. When the family is together, children do well. We have to schedule the whole day. Cell therapy is an important part. Comprehensive rehab, correcting the micronutrient imbalances and integrative therapies. This is the final solution to our children with special needs. So I'd like to end with two videos. The two biggest democracies in the world are India and America. And let's see what the Prime Minister of India and what the President of America have to say about this treatment. So what are the views of the Prime Minister of India and the President of the United States? By the way, this is a book that I have written, and I'm very fortunate that our Honorable Prime Minister, Sri Narendra Modi ji, has written an introduction for a book that I have written. So to have the Prime Minister write an introduction for you is a big honor. That's myself giving a copy of the book.
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या हम गए तो वहाँ गए उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
So with that, I'd like to thank you for your attention.